my name is Maya Martinez. I'm doing my presentation on Turner syndrome. These are the chromosomes that are in the human body. Let's start off with what is Turner syndrome. Turner syndrome is a disease or disorder that affects the X chromosome in females. The chromosome is either partially missing or completely missing. Here are some of the visible and non-visible signs that some of the patients might have or you might see. A webbed neck, low set ears, cardiac defects, slow growth, no puberty if slow puberty if at all, an absence of menstruation, and a lower hairline in the back of the neck. These symptoms, or signs and symptoms, may vary from person to person. So some of these patients might have some of these symptoms and others might not. Complications, we have a underactive thyroid, or also called hypothyroidism, heart problems, high blood pressure, hearing loss, vision loss, bone and skeletal problems, mental health problems. Those mental health problems might include ADHD, problems with body image, and learning disabilities of any sort, mainly in math, I have learned. Diagnosing Turner syndrome, you can be diagnosed at any age, from the prenatal stages in fetus and when you're pregnant to when you're 65 years old. Any female who is suspected to have Turner syndrome will undergo what's called a karyotype blood test. How to treat Turner syndrome? You can't really treat Turner syndrome. Turner syndrome itself is untreatable, but you can treat the underlying medical conditions associated with it, such as the heart problems, the kidney problems, the hypothyroidism, anything like that. Human growth hormone is normally given to patients with Turner syndrome to help them grow because they're normally very short in stature. Estrogen replacement therapy, most patients get on that to help with the menstrual cycle, puberty, breast development, stuff like that. Frequency and inheritance of Turner syndrome. Turner syndrome affects only 1 in 2,500 females worldwide. It normally doesn't get passed down from generation to generation or from family member to family member. If one family member has it, it is very unlikely that another family member will have it. For me, for instance, I have it, but none of my other family members have had it. Who sees Turner syndrome patients? Or doctors who see Turner syndrome patients? Endocrinologists, because it deals with hypothyroidism. If they have that, it has to deal with stuff that's inside of the body and the genetic code and stuff like that. Cardiologists for all the cardiac problems that might arise due to it, like leaky valves, stuff like that. Urologists for any bladder or kidney problems, because Turner syndrome patients are highly at risk for kidney disease and kidney infections and stuff like that. Orthopedists for any bone and or skeletal problems that might arise. Also for what's called a bone density scan, which tells the age of your bones. So if you're 25 and you get a bone density scan, it'll tell you what your bone age is. So if you're 25 and you get one and it says it's 13, that is a more likely sign that you might have something like this. My personal experience, I was diagnosed at the age of 11. I have hypothyroidism, I have a leaky valve, I am the only family member who has this disorder or disease, if you could call it that. I got put on growth hormone injections. During that time, I get them in the arm, the leg, and the stomach. I inject myself every day before bed. I got put on estrogen. I see an endocrinologist every 6 months for the thyroid and just to make sure there's no other issues. I have to give blood every 6 months for the thyroid issue. I see a cardiologist because I personally have a leaky valve. In conclusion, Turner syndrome is a very rare disease. I mean, it only affects 1 in every 2,500 women. It can cause other conditions such as heart problems, kidney problems, hypothyroidism, anything like that. Here is my citation page. And that is the end of the presentation. Thank you for watching.